Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today. In this episode, I will discuss the results of the FRAIL-AF randomized controlled trial. The main author of the trial is Linda Joosten, MD, from the University Medical Center Utrecht in the Netherlands. The trial was published in the journal Circulation on September 1, 2023. The FRAIL-AF trial was a randomized controlled trial that investigated the safety of switching from vitamin K antagonist, VKA, to non-vitamin K antagonist oral anticoagulant, NOAC, therapy in frail older patients with atrial fibrillation, AF. The trial was conducted in 26 centers in the Netherlands and included 1,330 patients. The primary outcome was the composite of major and clinically relevant bleeding. The results of the trial showed that switching from vitamin K antagonist to newer anticoagulant therapy was associated with an increased risk of major and clinically relevant bleeding. Hazard ratio was 1.69, 95% confidence interval was 1.23 to 2.32. There was no difference in the risk of thromboembolic events between the two groups. The median age of the patients in the trial was 83 years. The majority of the patients, 72%, had a CHADS-2 VASC score of 2 or less. The patients were followed for a median of 1 year. There were 163 primary outcome events, 101 in the switch arm, 62 in the continue arm. There were 16 thromboembolic events, 13 in the switch arm, 3 in the continue arm. The findings of the FRAIL-AF trial are important because they challenge the current practice of switching frail older patients with atrial fibrillation from vitamin K antagonist to newer anticoagulant therapy. The trial found that switching to newer anticoagulant therapy was associated with an increased risk of bleeding without a reduction in the risk of thromboembolic events. This suggests that vitamin K antagonist therapy may be a safer option for frail older patients with atrial fibrillation. The results of the FRAIL-AF trial suggest that switching from vitamin K antagonist to novel anticoagulant therapy is not safe in frail older patients with AF. VKA therapy may be a safer option for these patients. More research is needed to confirm these findings and to identify the best treatment options for frail older patients with AF.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.